Welcome to the Class 4 of Medicinal Chemistry 1. Today's topic is Anti-inflammatory agents, that is Chapter 3 of Unit 5. Anti-inflammatory agents are also called as NSAIDs, that is non-steroidal anti-inflammatory agents, which are used to treat inflammation and mild to moderate pain and in fever. Sometimes these drugs also called as analgesics and antipyretics because during the inflammation a pain and fever will be there. Fever means elevation of the body temperature and pain is going to be arises. Now the second specific use of these anti-inflammatory agents are used in the treatment of headaches, arthritis, sports injuries and menstrual cramps. And also sometimes NSAID is preferred for allergic preparation in cold conditions. That is common cold if it is occur at that time they are also useful. The actual definition of anti-inflammatory agents are used to cure or prevent inflammation caused by prostaglandins, that is PGE2. And already I told that these can be used in pain, fever, that is symptomatic relief from rheumatoid arthritis and osteoarthritis. Analgesics are the drugs that are used to relieve mild to moderate pain. It means that when inflammation occurs, when pain is there, analgesic also can work. And anti-inflammatory agents will also having analgesic activity. And when the inflammation occurs, fever also will be there. So fever means elevation of body temperature. At that time, that antipyretic drugs are very useful. So antipyretic drugs are used that reduce the elevated body temperature and bring down to normal body temperature. So these definitions are very important. You have to remember. Now we will see what is inflammation and how these prostaglandins are going to be synthesized, which is how a inflammatory mediators is going to be synthesized. Inflammation actually it is a localized condition in which a part of the body becomes reddened, swollen, hot. Hot means body temperature will be increases and painful, especially when a reaction to injury or infection if it is takes place. When cell injury takes place, several inflammatory mediators are released such as prostaglandins, leukotrienes, bradykinins, thromboxane and histamine, etc. These are all inflammatory mediators. When cell injury takes place, these mediators are going to be released and shows its action. So that action is reddened or redness, swollen, body temperature increases and pain is going to be arises. Now you can see how these mediators, that is inflammatory mediators, are going to be synthesized. When cell injury takes place, a cell wall will be ruptured and phospholipids immediately release arachidonic acid. Arachidonic acid with the help of an enzyme cyclooxygenase 1 and 2 to form cyclic endoperoxides. These cyclic endoperoxides will convert it to PGE2, PGF2 and PGD2. These are all especially prostaglandins because there are various prostaglandins are there. In that PGE2, F2 and D2 are responsible for fever and pain and inflammation in our body. They causes inflammation in our body. To the left hand side, arachidonic acid again it is going to be converted to hydroxy acid of arachidonic acid. That is a hydroxyl group will be added by an enzyme lipooxygenase and leukotrienes that is the another inflammatory mediator is going to be synthesized. So PGE2, PGF2 and PGD2 will takes up and form from arachidonic acids and the pathway is cyclooxygenase pathway. The formation of prostaglandin inflammatory mediators are formed by cyclooxygenase pathway because the enzyme is cyclooxygenase 1 and 2. Cyclooxygenase 1 and 2 are also called as COX-1, COX-1 and COX-2. All NSAIDs, that is anti-inflammatory agents, will inhibit these two enzymes, COX-1 and COX-2, and cyclic endoperoxides is not going to be formed. So prostaglandins are all also not going to be formed. Remember that when inflammation occurs, cell injury takes place. Well, cell injury takes place, cell wall will be ruptured, arachidonic acid will be released, action of this cyclooxygenase COX-1 and COX-2 immediately convert this arachidonic acid into cyclic endoperoxide. This immediately converted to a inflammatory mediators and causes pain, fever and everything. So to come over of this, to get relief of this, an enzyme cyclooxygenase 1 and 2 is responsible. If that enzyme is inhibited by the NSAIDs, so prostaglandin will not going to be synthesized and inflammation can be inhibited. If leukotrienes are responsible for that particular inflammation, so lipooxygenase pathway is there. Some other drugs are there that is anti-inflammatory only. That enzyme is going to be inhibited, so leukotrienes are not going to be formed. In the very first step, phospholipid will be converted to arachidonic acid. There is one more enzyme is there, phospholipase A2. If this is inhibited, arachidonic acid is not going to be formed. If arachidonic acid is not going to form, no other inflammation is going to be occur. This can be done by the corticosteroids. That's why the name we have given here, steroidal anti-inflammatories, non-steroidal anti-inflammatories. So today what we are going to be study in this semester and in this chapter is the agents which are used as an anti-inflammatory but they are not having the steroidal nucleus. But in the next in our higher classes what we are going to be study which is known as corticosteroids that also can be used for an anti-inflammatory. Those drugs containing the steroidal nucleus. So this is the biosynthetic pathway of prostaglandins and leukotrienes. And remember three enzymes, phospholipase A2, COX-1 and COX-2 and lipooxygenase. If you see the mode of action as I told, NSAIDs inhibit cyclooxygenase. In the previous slide you have seen that the enzyme that catalyzes the synthesis of cyclic endoperoxide. from arachidonic acid to form prostaglandins. These two cyclooxygenases, COX-1 and COX-2, are isoenzyme. The function of COX-1 enzyme is important. It is required to our body because the prostaglandin, which is going to be synthesized by this COX-1 activation of this enzyme, it involved in the normal cellular activity, means it protect our gastric mucosa. The prostaglandins, which are going to be formed by the activation of cyclooxygenase 1, those prostaglandins will protect our gastric mucosa and maintain our kidney function. If this enzyme is inhibited, then that prostaglandin is not going to be synthesized and it may cause us kidney failure and also gastric acidity. So that's why COX-1 selective anti-inflammatory drugs are banned. It is not sold over the counter. COX-2 is responsible for the production of prostaglandin at inflammation site. So COX-2 selectivity is most important, but COX-2 selective inhibitors may eliminate the side effects associated with the NSAID due to COX-1 inhibition, such as gastric and renal effect. So COX-2 selective drugs can be used because you can eliminate the side effect associated with the NSAID. When NSAID arises, so COX-1 side effect also will be arises because COX-1 is inhibited. So COX-2 only during inflammation, selective COX-2 inhibitors only we have to prefer. The classification of anti-inflammatory is most important. You have to practice this structure and you have to remember. Definition also will be asked. What are anti-inflammatory, antipyretic, analgesics? Classify them. Classify anti-inflammatory agents with examples. Such types of questions will come. If we see the classification of NSAIDs, the first category is salicylic acid derivative, that is salicylate. Salicylates are having more uses. They possess antipyretic, analgesic, and anti-inflammatory properties. Along with that, they have proven to be therapeutically beneficial in gout, that is, inhibit the synthesis of uric acid formation and use in the arthritis and gout. And also, salicylates are having ability to inhibit platelet aggregation. Hence, they can be used in heart attack and stroke and reduces the risk of myocardial infarction. Recent studies suggest that the aspirin are useful and protective against colon cancer. So salicylic acid or salicylates example are sodium salicylate and aspirin. So sodium salicylate is sodium 2-hydroxybenzoate. It is used for fever and for the relief of pain. It also possesses anti-inflammatory action similar to that of the next drug, that is aspirin, and symptomatic therapy in the gout. Aspirin is acetyl salicylic acid or 2-acetoxybenzoic acid. So already we have seen that salicylates are used in gout, arthritic condition, minor aches, headache, pain, and even in myocardial infarction. So these two are very useful drug in that, especially aspirin. Aspirin is very common and well-known drug. The second category is para-aminophenol derivatives. In these examples are phenacetin, acetaminophen, that is paracetamol. These especially are used as an analgesic and antipyretic because when injury takes place, inflammation occurs, there will be a pain and body temperature is going to be increases. So hence these drugs, that is para-aminophenol derivative, is most useful in analgesics and antipyretics, but they does not have any anti-inflammatory action. Why they have included in this classification means, so inflammation contains pain and as well as increase in the body temperature. So that's why these drugs are useful in the inflammation. So this is the structure of phenacetin. It is having analgesic and antipyretic effect similar to the effect of aspirin. And next drug is paracetamol. It is also a very common drug, that is acetaminophen. It is also having an analgesic and antipyretic property. In long dosage, more than 10 gram if it is used for the adult, it may causes hepatic damage, and more than 3 gram if it is used, it damages the liver and causes hepatic damage in 2 years of children. Thank you.